Cough suppressants are a group of medications which work by stopping the urge to cough and reducing cough. Cough suppressants may contain ingredients such as codeine, dextromethorphan, promethazine, and diphenhydramine. They may also be found in combination with other ingredients for relief of runny or blocked nose. You may take this medication with or without food. For syrups, shake the bottle well before use. Some common side effects may include drowsiness or dizziness. If affected, avoid driving, operating machinery, or other activities which require concentration. Other common side effects may include nausea or vomiting, stomach upset, and constipation. These side effects are usually mild and will pass quickly. Cough suppressants may be taken when required for a short period of time. This means that you do not have to take them if you do not have any symptoms. If your symptoms do not go away or worsen after 1 week of taking these medications, please speak to your healthcare professional.